So if you take, for example, the issues of the spread, with large numbers, the whole world has actually had to reduce the size of meetings. And in this case, we have actually examples of where in a church setting, in Daegu in Korea, it was one church event that spread the infection to 60% of the population. It was large numbers of people at the same time. In the Free State, we had a similar situation where we had to actually deal with it. What we are finding now in the Western Cape, it is in the shops. So the restrictions that need to be put into the numbers of people gathering at the same time is very, very important. And so how we do that in a way that does not create a sense of being an unconstitutional approach is very, very important. So we're going to be looking at all of that. And if you look at in the Eastern Cape, most of the experiences that are associated with the spread of the infection comes from funerals. Therefore, when we talk about restriction of the numbers on funerals, it's not so much the body that of an infected person that causes the infection. It's the people who are infected, maybe asymptomatic or maybe mildly symptomatic. When they gather together, that's where the infection comes in. So we need to therefore try and align the constitutional issues with the need for containment, because at the end of the day, it's all been done mainly to save lives. It was meant really not to abuse power, but to make sure that we help people to contain the spread of the infection. And I think we have seen how the large churches stopped gatherings during the Easter weekend. That actually helped a lot to reduce the spread of the infection. It would have been a huge explosion. We avoided that because we were able to appeal at that level. So there are many of these restrictions that we need to bring in just to help the community, not so much that there's any desire to abuse power or to limit the rights of people beyond what is necessary to contain the infection.
Minister, some weeks ago, you and your team gave us what really was a wide-ranging presentation on what we could expect over the coming weeks, the different levels of the pandemic in South Africa. So we're now sitting, I'm looking at your Twitter page, and we're sitting at positive cases reaching for 36,000 now, just over half of that number recovered. What stage of the pandemic are we at now in South Africa? And perhaps give us a sense of, are we seeing more numbers, more infections that perhaps we had initially anticipated?
Yes, indeed. We were hoping that we can contain the numbers a bit more than what we are seeing now. However, we didn't have a particular figure that we're actually looking out for. The earlier projections from the models that we shared last week were indicating three sets of graphs. The first graph is what we call a do-nothing scenario, where it could have happened that on the first time we get the infection, it would have rapidly surged to a point where it overwhelms all our systems. And therefore, when we put a lockdown, we deferred the surge so that the rise goes a bit later. It then created two hypothetical scenarios which the modelers put to us. The first one is what we call a pessimistic scenario. That is where you have a surge that arises from June to July in the whole country. And then we had an optimistic scenario where we do everything according to the book, and therefore we defer the peak to be later on, later in July, later than July, say towards August. And we were hoping that we'll push more towards that kind of level. So when the lockdown happened, it actually showed that there was a huge shift to the latter part of this. But the outbreak that happened in the Western Cape started changing the pattern. The earlier models were showing that most likely the peak will arise in Gauteng first, and then KwaZulu-Natal, and then Western Cape third, and then the other four provinces would follow. But as it has now appeared, it is not Gauteng, it's not KwaZulu-Natal, rather it's the Western Cape where the surge has happened. And when we've gone into detail to look at what happened in the Western Cape, we are able to see that the infection arose in the clusters of people who are involved in retail shops. About 4 or so of those shops were ultimately closed and then reopened and so on. And in factories, one was a pharmaceutical manufacturing factory and the other one was a food processing factory. These factories were actually exempted by the lockdown rules because they were dealing with essential services, and so they were allowed to continue to operate. But at the time, the containment measures were very weak, and therefore the infection spread quicker. Now we are dealing with the consequences thereof. And so what we are now seeing is that the surge is coming a bit earlier in the Western Cape, and in so saying, we think that we might have a slightly different pattern where one province is going to surge, and then the others will follow afterwards. Possibly Eastern Cape, Gauteng will follow, and then probably KwaZulu-Natal. But as you can see, even the modelers didn't get it right. We will only know when all this information is fed into the model, and then the models are refined so that they give us a better sense. They're getting a bit closer to the reality now than they were before. So what we are seeing is early increase in the Western Cape, and we're already seeing that the numbers are beginning to be higher than what we anticipated them to be, probably by a week or two. Therefore, we ended up with a need for additional beds needing to be provided a bit earlier. That's why we've had to bring in the private sector to say they're going to give us beds now until the beds are ready next week in the Western Cape, and therefore we'll then be back to track. And then we are going to provide additional beds so that if the numbers continue to increase, we've got places to be able to accommodate people. That we believe is on course.
Yeah. So, Minister, you've already really painted an idea of how the Western and Eastern Capes are linked. President Cyril Ramaphosa had been in the Eastern Cape, I think it was last month, where he said he was impressed with the way through which the province was responding to the epidemic there. At which stage would, provinces like the Western Cape or the Eastern Cape be forced to move to level 5 of the lockdown, given the trajectory of the outbreak in those two provinces? Has the department thought it through yet about, which stage they might draw the line and essentially revert these provinces back to level 5 of the lockdown, or a stricter restriction?
Yeah, I think we should call it a stricter restriction rather, because what it's going to mean, we've painted 3 scenarios. The first scenario is what we call the low transmission trajectory. And these are areas where people have either got no cases or few cases, and the numbers are not rising too fast. And all of those areas would like to move them to normality as soon as it's possible. And therefore, we are having a strategy of a surveillance where we watch any new cases. We want to contain them as quick as possible so that we don't increase the numbers. So they need to stay at low transmission level. So that's one group of areas. The majority of all the districts in the country and metropolitan, they are in that kind of category. Then the second group is what we call hotspots. We have indicated here that we're looking at areas where you've got more than 5 positive cases per 100,000 of population. We're at about 13 or so of those in the whole country. That's the major metros, Cape Town, Nelson Mandela, eThekwini, Johannesburg, etc. 13 of those have been counted to be in that lot. Now, in those, we've got a very specific intervention program that we've put up. For all of them, each metropole or district must be divided into sub-districts, into a cluster of wards. We put up a team of specialists, epidemiologists, family practitioners, infectious disease specialists, public health specialists. All of those people need to then focus on what's the population size in that cluster of wards? What is the number of positive people? Can they then account for each and every one of those to make sure that whoever is positive is taken to isolation, whoever the contacts are to that particular positive case will be also taken for quarantine, and therefore we close the cycle. We need to break the cycle of infection in a much more intensive way. They must also identify people who are having comorbidities and at risk, like people with blood pressures, on treatment for TB, on diabetes and HIV and so on. Treat them in such a way that they avoid them getting the infection. So that is the intensive approach that we're taking at that level. If all of that does not work, it means we have to impose further restrictions. We will therefore have those restrictions to be aligned to these conditions. What are the things that need to be done to contain the infection? If we can prove that having put those mechanisms in place, there actually is no change. That means now we know what they say in this campaign. They say if you want to stop the transmission, you must stop, you have to stop the virus. If you want to stop the virus, you must stop people from moving. And that's really what crudely you can put it. So that's how the lockdown situation arises. When you think that the numbers of infections are such that you're going to overwhelm the hospital beds, the numbers of staff that you